know, I know we've been busy not able to take a lot of calls, but we are checking with the Purple People Meter from time to time. If you buy things door to door, we're talking home security. We'll try to squeeze a call in maybe later, but we have so much good information. You know, this is a statistic I find amazing. 97% satisfaction rating. But I'm also a little troubled because I can't believe it's 97%, not 100. Dr. John Dishler, I've never talked to anyone who's ever been to your office ever or had the surgery done that didn't love it. So I need to ask you something. 97%. So the 3%, what would it be that it's not perfect or what? Because you've brought people in here who could not see their hand that are now reading tiny print. What is that about?
Well, you know, I don't think they're really super dissatisfied. Right. It's hard to get any group of people 100% to agree on anything.
But 97% is amazing to me.
Yeah, we think that's really, really great. I mean, when you look at it compared to people's satisfaction with anything else or other medical procedures.
But I don't want people thinking it's 97% successful because you haven't had a failure, really.
Right.
What you've had are maybe people who were really bad and you brought them back a certain way. Most people, don't you bring back more than 20/20?
Right. For instance, there's some people that say, well, I was overall pretty happy. I could see far away, but I couldn't read quite as well as I wanted to. So they just, you know, aren't clicking their heels happy.
But 97% of the people say, I can see better than better. Better than normal.
Right.
Normal 20/20, right? And almost everybody you've brought in here was better than that.
Right, but when we ask people, would you refer someone else to us, virtually 100% say yes. If someone wanted a LASIK, would you use us as a referral source? So
50,000 procedures you've done.
Yeah.
So that's incredible. And then that's why you get listed in places like Forbes. And that rating service, we should talk about it. That's an independent rating service.
Right. They pick the top 10 of different things, and in this issue, they picked the top 10 LASIK surgeons in the country.
Yes.
And we were amongst those, and they do their own independent research and analysis. So, and that's why we have patients coming. I mean, last week we had patients coming from out of state here. Tons of people that come from all over. Lots of doctors. I just did LASIK on a heart specialist last week who said that, you know, we had done several other people in his group. So we kind of think of ourselves as the pilots, you know, all kinds of groups, and farmers and truck drivers and athletes. Everybody, every walk of life. Yeah,
and people that really need their eyes. And so let's talk about evaluating the procedure. First of all, the technology is proven. The technology itself.
It's proven, it's mature, it's there.
Accurate.
Yeah, it's the way it should be. So the critical part now is picking the people that will be good candidates to have this done. And this is the most important thing I'd like to get across. We see people that were told they were bad candidates for LASIK, and yet we say, you know, you're really a good candidate. On the other hand, we've seen people that say, well, I went somewhere else, they're ready to do surgery on me next week, and we have to say, well, you're really not a great candidate. So picking the right candidates, doing the right diagnostic testing, having the right team of people.
And you do an extensive evaluation. Free of charge.
Free of charge, yeah.
Whether they get it done or not. And hopefully you want to make patients and guests, people that will come back or refer, but you don't ask them that up front. Are you going to have it done? You just do a full evaluation.
Right.
Now, what does that involve?
Well, that involves talking to people, the most important thing, finding out what their needs are, finding out what they're wearing, and then using the latest diagnostic equipment to test their eyes, check their eyes, make sure they don't have medical problems, eye problems. If they do, clear it with, you know, their doctor first.
So you want to know if they're a candidate or not a candidate.
Right. So it's a medical thing. You know, it's not people should pick their doctor. I mean, the big message is pick your doctor.
Because the technology's there, but what good is that without a good doctor?
Right.
Let's talk about that. Let's talk about some of the factors. I think we have a graphic here because this is very, very important. Licensing is so obvious, isn't it?
Right. Now, you don't have to be, everyone has to be licensed to practice medicine. You don't have to be board certified to practice a specialty. Most people are, not everyone is.
I would want a board certification.
You want a board certified doctor. A lot of surgeons, now this is a smaller group, are members of a very prestigious organization, the American College of Surgeons. And
very important.
And it's very important, and it's heart surgeons and all kinds of surgeons. And I'm a member, I'm a fellow of that.
And then referrals?
Referrals are very important, right? You know, you want to have at least talk to somebody who's had LASIK or knows someone that's had LASIK, and where did they go and what was their experience like. you know,
then the staff.
And the staff.
We get a lot of great comments.
Yeah, how do they treat you? Are you treated with dignity? Do you get your questions answered? Are they available? You know, those kinds of things. And then look for other resources, other organizations.
Like this Forbes magazine, like just other independent referrals or endorsements. I want to mention something that you didn't have on there.
Sure.
But it goes along with, I think, the staff and you. Your own surgical center, that is so important. I don't think people realize that you actually have a day surgical center. I mean, other doctors theoretically could use it for surgery.
Absolutely,
because it's state certified.
State certified surgical center. What does that mean? It means we control the temperature of the air. We have backup power supplies. We meet all the guidelines of a hospital for safety of the patients.
And people come right there, have it done. They don't have to go anywhere else to meet you.
Right. All our staff is certified in advanced life support. If somebody were, God forbid, to have some kind of an emergency, we're prepared to take care of it, unlike a lot of LASIK centers that are just set up in a shopping center and, you know, best of luck.
Now, most of the time, you can achieve the correction better than normal, and you can do it with this OptiLASIK now, which is even quicker. Explain what that is.
Well, OptiLASIK is a technology that is proven, it is FDA approved, and it allows you to correct virtually any type of correction, nearsighted, farsighted, in a way that keeps the natural shape of the eye so there's no nighttime problems, side effects, and things like that that were associated with the earlier lasers that are still being used by some laser centers. And it can do the treatment very, very fast and very, very accurately.
And the faster, the more accurate, right? Because
the faster, the better.
Because you have less margin for error.
Right.
And then bladeless surgery, again, this is something you'll hear. This is true bladeless surgery.
An option in many places, but at our center, it's standard. Everybody gets bladeless surgery. So that's not a question of do you want to pay an upgrade fee to have bladeless surgery.
In fact, you don't have upgrade fees, do you?
No, we don't. In fact, now that it's the summertime, and this is the best time to have LASIK. People don't realize it. That you're back at work quickly. You can do all the outdoor activities in a week or two. And because it's the summer, that's the one time of year where we have sort of a sale, and we offer people an additional 10% off over our already guaranteed lowest price for the technology. So people aren't paying any extra, and they can even save a little money by doing it over the summertime.
Now, when he talks about 10% off, the guaranteed lowest price, when he says guaranteed lowest price, I've looked into that, and it really is. For the same correction, the same technology. That's so important. Anyone can use an older laser or older technology where some of the royalties have expired, in other words, that they pay the manufacturer or the inventor or the developers. This latest technology, bladeless surgery, same correction, you can't do it any better, you can't do it any less expensive than Dr. John Dishler. So that's the guaranteed lowest price. And in addition to that, 10% off. Now, more information here from this magazine. This is very important. You are giving these out. Can people call for one of these or come by and get one?
They don't have to come by. They can come by if they want to, but they can just call or just contact us on our website, and we'll send them a complimentary copy of Scene magazine.
And this is independent?
Independent magazine, and it's really great because it says what things to look for in a LASIK center. We don't publish this. It doesn't have anything about us, but it's the inside scoop on what you need to know, especially for younger patients, the things that they're concerned about.
You've done plenty of younger patients. In fact, what do you have patients from what age to what age?
The youngest are 18 and the oldest about 70. So we've seen people, you know, throughout the range of ages. A lot of people in the summertime, students, very popular. They have school off in the summer.
And by the way, 24 months, zero financing. Call for details on that. Okay, and if you are if you come in for a consultation and you're a candidate, even if you decide not to have it done there, of course you probably will, you're going to get a free iPod. Okay, so it's the last week, is it, to get an iPod?
That's right.
This is the last week for that offer?
If they schedule this week, right? And we want serious candidates that really are interested in LASIK. But come visit us, put us on your short list. We'd love to give you an iPod just for your time. And call now.
Here's the number, 303-793-3000, 303-793-3000, Dishler.com, Dishler.com.